Okay, so the next section, I will pass on over to Ricky again, and she will talk through the challenges themselves. Ricky, over to you.
Thanks so much, Dan. So essentially what I'm going to take everyone through at this point are the individual hack challenges that you'll have the opportunity to take on and really center yourselves around and throw yourselves into throughout the course of the hack. Each of these challenges will be made fully available to you. What I'm doing today is just giving you a really light introduction to each, so you've got a flavor and you can start a really high-level thought process of the hackathon challenge to come. So as you've heard lots about today, and thank you for bearing with us through all of this time so far, despite the very clear guidance of public health bodies in nearly every nation, the awareness of influenza impact and the uptake of vaccination in our region continues to remain low. So all of our hack challenges center around this fact and work to find solutions that can help to overcome it. And the challenges themselves were split into three different types of problem statements that work to address different types of barriers that stand in the way of influenza risk being fully understood and vaccination uptake being able to be driven forward. And those three buckets are, first of all, awareness. So as we've heard plenty of today, there is a really low awareness of the real risks of influenza and the importance of decreasing that burden. Secondly, as you've also heard a lot about today, there are a huge amount of policy specific barriers that stand in the way of us being able to progress this situation forward. For example, the lack of ability for pharmacists in most countries within the region being permitted to vaccinate, and also some of the challenges that come with inefficient surveillance systems, as we've just touched on with one of the last questions for Dr. John. And the third bucket, which is a particularly important bucket, particularly for so many of you on the line today, are challenges that relate to healthcare professional capacity. There is obviously only a finite amount of time and resource in this world, and any solutions that are considered need to be able to work within that capacity and work to extend that capacity. So with those three different types of barriers in mind, I'll now very briefly take you through the individual challenges that will be posed to you and you have the opportunity to select from. So we're first of all going to look at the problem statements that are tied to the issue of low awareness of the impact of influenza and low awareness of the potential impact of influenza vaccination. And just to very briefly set the scene for these couple of challenges related to awareness, a key statistic here. As you've heard today, influenza can affect anyone, young or old, and it seriously disrupts not only our lives, but economies and societies at large. Everyone is at risk. However, in vulnerable populations, that risk is really intensified. So those with underlying conditions, particularly chronic conditions such as diabetes and heart diseases, those complications can be very severe. And this does need to be a focus point when it comes to the issue of influenza burden. So that brings us to our first challenge, our first problem statement that you've got the opportunity to choose from. So specifically, this is built around the fact that people with diabetes are 3 to 6 times more likely to be hospitalized due to influenza, as flu can make it much harder to control blood sugar levels. So that's a very critical statistic. And obviously, the incidence of diabetes in our region, in most countries, is significant and increasing. So the specific problem statement here is what 5 healthcare professional-led interventions can be implemented in your country to improve influenza vaccine uptake, specifically for people living with diabetes. So here we are wanting to ensure that we have the ability to infiltrate this very vulnerable community and make impact where it can have the most significance very early on. And we are suggesting in the problem statements where we are calling for you to choose upon your country, if there are any groups that ultimately blend, that you just choose the one single country to focus on, so you can take into consideration the environment within that nation. So the second challenge, also tied to the barrier of awareness, centres around the fact that people who are aged 40 or more are at higher risk of having a stroke up to 2 months after influenza, a statistic that is not very well known at all. So immediately following a flu infection, the risk of heart attack is actually elevated 6 times. Yet in older adults, and of course, 40 plus isn't all that old when you're looking at the immediate bracket there, vaccine uptake continues to remain very low, as we've all heard today. So the specific problem statement for challenge number 2 is how can public health bodies work with stakeholders who educate the public on their cardiovascular risks, ensure that influenza vaccination consideration becomes a routine component of these education efforts. So this challenge is all centered around trying to tap into to the ecosystem that might be supporting those at cardiovascular risk already. So rather than trying to go out there and create a whole new system or a whole new intervention, how can we tap into the ecosystem surrounding those people who are at risk of CVD? So from here, we move into our problem statements that are primarily centered around some of the policy challenges that you've heard about today. So just a key statistic here to set the scene for these challenges. The World Health Organization urges member states to reach a minimum of 75% influenza vaccine coverage among high-risk groups. And for all of the countries in our region, only one has managed to do that so far. A very humbling and daunting statistic indeed. So in follow-on to that key fact, and some additional background to it as well, starting the top of this slide. As I've just mentioned, the large majority of countries in Asia and the broader region are well behind that 75% minimum target for vulnerable populations. And those vulnerable populations, just for clarity, include people who are aged 65 or above, people living with chronic conditions such as diabetes, asthma, chronic heart and lung diseases, children aged 6 months to less than 5 years, and also health workers, obviously a really critical point for all of you. So with that, the specific problem statement for challenge number 4 is asking you to suggest 3 interventions that the government or a leading public health body in your country can roll out over the next 12 months specifically to increase acceptance of and engage healthcare professionals in the implementation of the World Health Organization guidelines. Incorporating, of course, the perspective of the country's or your country's socioeconomic ambitions. So, of course, every country has different resource levels and different ambitions when it comes to looking after their most vulnerable. We do need to be realistic in the solutions that are being offered up. But the challenge here really revolving around how do we ensure that healthcare professionals are the solution or the driving force in how we go about working more specifically to the very clear guidance from the World Health Organization. So on our next slide here, just another key statistic feeding into our policy potentials, our policy problem statements, a statistic that you've heard so much about already in very good and great detail. That simply being here in Asia, pharmacists are not authorized to administer vaccines, unlike in many of the countries you've just heard about, Canada, the US, Australia, New Zealand, and many European countries. So with that, for our 5th challenge statement, we are looking to be very specific about how that situation could eventually be turned around. I'm not going to walk you through the top line background here on this slide because you've heard so much about this topic today already. I'll jump straight to the problem statement, which is specifically in countries where pharmacists are not currently able to vaccinate, which is the large majority of countries for us. What rationale and support can public health bodies and private healthcare players provide so that pharmacists can formally become part of the solution, including reimagining the role of pharmacists in the broader healthcare ecosystem? And here we're specifically looking for the most impactful way on top of that for that rationale to be taken forward to lawmakers. So there's obviously a huge potential in this challenge, given everything that you've heard today. We've seen and know there is a direct correlation between pharmacists being permitted to vaccinate and vaccine uptake increasing. So a really powerful opportunity to be explored. So another key statistic, just to center us ahead of the next challenge, again, staying on the policy-orientated barriers, and a key barrier and statistic that we've touched on with some of the questions already today, that being that surveillance is obviously an essential foundation for monitoring and evaluating any disease process. And it's especially critical when any new disease appears, as we're all acutely aware of in the current COVID-19 environment. But we've heard from Dr. John how critical that real-time monitoring and surveillance is in all aspects of infectious disease, and even at that fundamental community level when it comes to influenza. So against that backdrop, our sixth challenge rests on exploring that lack of adequate and efficient surveillance mechanisms that does exist in many of our region's countries. So, without that accurate real-time assessment, there are real implications, performance and cost benefits of annual influenza vaccination programs can't be fully understood without it. So while most countries have some form of influenza monitoring system in place, those approaches and the time and the resource that is given to them is quite inconsistent across our region. So with that, the very specific problem statement for Challenge 6 is how can convincing evidence of the burden of influenza be captured with minimal resources, for example, financial investments and the commitment of time from healthcare professionals. So with this problem statement, we want to be very aware that many countries in the region who do have inadequate or surveillance systems or surveillance systems with potential for improvement, it's most likely the case because of resource constraint. So here we want to be creative and work within that context to see how incremental advance can be made. So from here, we start to move into our healthcare professional capacity orientated challenges. So a key statistic to set the scene here, the World Health Organization recommends annual influenza vaccine for healthcare workers to protect them and at-risk groups against influenza infection and prevent exhausting public health resources. Yet still, the uptake of vaccine among frontline healthcare workers remains suboptimal. So the very specific challenge that we have here off the back of that statistic, just to paint some more of the background first of all, the barriers to uptake amongst healthcare workers range from a few different sources. A lack of time, number one. The fear of contracting influenza via vaccination is actually a noted barrier from healthcare professionals themselves. There is some distrust in vaccine efficacy data to a reluctance to over-medicate. But then issues such as low risk perception, the denial of social benefit of influenza vaccination, low social pressure, not having been previously vaccinated against influenza, or not having previously had influenza, as well as a lack of adequate knowledge, all add to this decreased uptake. So here, the very specific challenge is beyond compulsory vaccination, what government or public health body-led interventions can be put in place to specifically inspire healthcare professional workers and those include GPs, pharmacists, nurses, anyone that can be working professionally on the front line to manage their personal influenza risk via annual vaccination. And given the future professions of so many of you on the line today, we hope that this will be a really inspiring and interesting challenge to take on. So moving to our next key statistic to introduce our next challenge, again looking at the barrier of HCP capacity. As many of us know, either as consumers of healthcare or from our professional studies and professions, GPs, primary care health workers, typically in most countries, only have 5 to 10 minutes available for patient consultations. And that is quite simply not always enough time to be reminding people of their influenza risk and the need for influenza vaccination. There is obviously a huge amount that needs to be considered and prompted within that very finite space of consultation time. So given that, here with challenge number 8, what we want to do is inspire patients to be part of the healthcare professional capacity solution. So the specific challenge here is asking how we can educate patients or citizens in general so they can be inspired to proactively ask about influenza protection during their regular appointments to help ease that burden on physicians. Physicians can obviously only remember so much in the one consultation, and the more that we can do to educate patients to be proactive, shared decision makers with their healthcare professional teams, the better. So we're not only prompting them to explore their specific influenza risk, but we're also inspiring them to take on a greater and more proactive role in their health and their healthcare generally by encouraging them to proactively bring key topics to their healthcare professional team's attention. So one key stat here, just to revisit the awareness topic, and this is quite a big topic and a big challenge to end on. So the key statistic here, which we've heard some about today, when more people, including healthy adults, those healthy adults being the key focus here, get vaccinated, that potential for herd immunity, which Kevin spoke us through, increases and helps us to protect the community at large. But again, influenza vaccination targets, no matter the population we're looking at, and especially the general healthy population, is far from ideal. So the last challenge that we've got to speak you through today and for you to choose from when it comes to deciding your hack focus is looking at how we can inspire healthy adults to become part of the solution. So as some further background here, influenza vaccination coverage proposed by the US Centers for Disease Control and Prevention can help to establish herd immunity, which can only be achieved through stronger influenza prevention messages and programs. Ideally, looking at 80% in our healthy population and 90% coverage in our vulnerable populations. So specifically, the problem statement thrown to you for this challenge is how can the role of healthcare professionals be further formalized in advocating for healthy adults to consider protection against vaccine preventable illness, including influenza. Obviously, there's so much that we can do to focus on our more at-risk populations, including our vulnerable populations from a health perspective, as well as those working on the front line from a healthcare professional point of view. But the real ticket beyond that to significantly reducing the preventable burden of influenza is how we take the healthy population, the general population, on that education and behavior change journey. So just a couple of finishing thoughts here before I hand you back over to Dan. So having heard each of the challenges and the problem statements that you'll have the opportunity to choose from, just a couple of reminders, mostly reiterating what you've already heard today, of what you as future healthcare professionals can do to be problem solvers for these very key issues. We need to remember there needs to be a very clear and collective understanding that to effectively highlight the risks and complications of influenza, we need to be talking to not only vulnerable communities, but also to healthy adults. And we have to be able to emphasize that regular flu vaccination improves our potential for herd immunity, which is so incredibly critical. We have to remember that that as healthcare professionals, there is a really important role to be played to educate and continue dialogue on the need for influenza vaccination. And within that, there are very unique approaches to be explored for consistent vaccination coverage, particularly when it comes to our frontline healthcare workers. And if we can't take frontline healthcare workers on the journey, it of course becomes that little bit more difficult to inspire them to be a conduit of the message to their very own patients. And then when it comes to healthcare professional interventions, there's obviously lots at play here, but there needs to be very specific consideration of how healthcare professionals can work with governments and government influencing stakeholders to ensure that there is multidisciplinary and multi-stakeholder dialogue and coordinated action towards a shared goal. And with the right policy and training in place, there's many new avenues that we can open up to increasing the potential for vaccine uptake. And that, of course, includes the potential for pharmacists to be permitted to vaccinate in countries where that today is not a reality, for all of the reasons that you've heard Dr. John talk you through. So I hope a quick walk through the challenges and problem statements that you'll have the opportunity to select has inspired some specific questions. And again, please do keep in mind you'll have full access to all of these challenges and problem statements. But at this point in time, I'll hand you back to Dan to facilitate any questions that you might have at this stage.
Thank you, Ricky. Wonderful talk through of all of the key considerations with the challenges. There has been a lot of thought gone into these challenges to ensure they are as relevant and as critical to current consideration as possible. So I will open the floor for some questions. I appreciate there may be a few here. Okay, so there is one from Joey. Okay, so is it possible to have some more time to discuss challenge 1, given that we need to analyze and present 5 possible interventions? 5 minutes seems a little too tight. So a good point, a good question. So the challenges will be sent to you following this session, so you have plenty of time to really digest and understand the challenges. The deadline for submitting your chosen challenge will be the 31st of July. So you'll have plenty of time to really get into it and really discuss it. But they will be sent to you after this session.
And just to quickly add to that as a word of advice for those challenges that are asking for a longer list of solutions, please do bear in mind that in those instances, we're not looking for the same level of detail if you're being asked to come up with just one intervention. In those cases, we're more looking at the breadth versus the depth of solution.
Absolutely. Okay. Any other challenges from those on the line? Again, as before, please do let us know. We're happy to answer any questions after the session. I have a few last-minute housekeeping points after this, but this is the last Q&A session. So if you're holding on to any questions about the challenges or the rest of the please do let us know now. We've got 1 or 2 more minutes, and then we will move on. In terms of the process for submitting your chosen statement. Once you receive them, you'll be sent an email with the challenges, and then if you just reply to that email, the team will pick it up, and we'll assign you on the other end. Okay. Okay, one more question has come in. Ricky, do we need to cover all 3 interventions?
No, absolutely not. So with each of the problem statements, we have attempted for them to be geared towards just one type of barrier, whether that barrier be awareness related, whether it be policy related, or whether it be HCP capacity or intervention related. So while your solutions, or when you're presenting back your solutions, you should be keeping in mind how your solutions work specifically to overcome the specific barrier that frames your particular problem statement. Of course, certain solutions will always work best if they're addressing multiple different areas, but we're asking you to be concise for multiple reasons, but also to make sure that you have an opportunity to really take a deep dive into a certain area and not spread yourselves too thin in regards to the thinking and how robust it can ultimately be.
Okay, thank you, Ricky. Another question here from Katya. Can our presentations use visual aids?
They absolutely can. And while there's no pressure or expectation for visual aids, they are very welcome. And as I mentioned earlier, we definitely encourage each group to have a really solid think through what is going to help them stand out from a presentation perspective. Your presentations are short, so your options are limited in terms of how creative or visual you can be. But do bear in mind, again, your very busy judges will be hearing lots of presentations, and you want to stand out in their memories, not only for solid content, but also in terms of how it was delivered.
Excellent, thank you. Another question here, are we allowed to address only one problem statement?
Yes, ideally we are looking for you just to focus on the one problem statement. And again, the rationale for that is so that there can be enough time to take a really robust dive into a particular issue. And so that we have, or as a result of the hackathon at large, we've got some really detailed thinking that has the capability to work out there in the real world.
Excellent. Another question here. Can we choose countries which none of the group members belong to in tackling the challenges?
Yeah, you're welcome to, of course. We have assumed that of course you'll have better background understanding of the healthcare ecosystems when looking at a country that at least some within your group are residing in, if not citizens of. But if you would like to look at a challenge that addresses some specific healthcare needs of another, we won't mandate that you can't, but it's worth thinking about whether that would give you the best ultimate outcome, given the time that might take away research-wise that could be dedicated towards solution finding.
Excellent. And the last question, how many members from a group are allowed to present their slides?
That is your call and your call to make. Again, it's a really short presentation, so it's worth thinking about what the numbers look like. But we would definitely encourage you not to leave presentation responsibility with just one or two. Your judges will want to see and know that your time together has been a true group effort, and quite simply, ensuring that it's not just the one presenter will ensure that your time with the judges is ultimately more engaging.
Excellent, excellent. Okay, I think that's all of the questions. Thank you very much, Ricky. Wonderful. As I mentioned, we just have a few more housekeeping points to get through.